Hi, everyone. Thanks for joining us today for this wellness webinar. I'm Lori Berkheimer, a marketing and communications manager here at Mount Carmel. And with this being a new year, many people are in the mindset of losing weight, becoming healthier in 2025. So today we're going to talk about some ways Mount Carmel can provide you with tools to lose weight and reach your goals this year. I'd like to introduce one of our bariatric surgeons, Dr. Pagé. He is certified by the American Board of Surgery and a diplomate of the American Board of Obesity Medicine. Dr. Pagé will share some important information with us, then we'll open it up for questions, and you can type your questions in the Q&A section. Dr. Pagé, thanks so much for being here, and I'll turn it over to you.
All right, thank you. Good to be with you. Good to be with everybody. We'll have some different topics, and like Lori said, we will have plenty of time at the end for more questions, and hopefully most of what I'll talk about will come from the questions that the listeners have. So we'll go through a few slides, starting with weight loss surgery. So we have a couple options in our program as far as weight loss surgery, or sometimes we hear about bariatric surgery. So weight loss surgery, bariatric surgery. The newer term that we use in the field is now metabolic surgery because it actually changes the metabolism of the patients after surgery. Those three terms are used interchangeably. So what is it? Bariatric surgery. So it's a procedure that in all cases makes the stomach smaller, and the goal of making the stomach smaller is to make it where patients are more satisfied with smaller amounts of food. But like I said, there's also a lot of metabolic effects from those surgeries. The two surgeries that we offer at our center right now, the sleeve gastrectomy is the first surgery, and then the other surgery that we offer is the Roux-en-Y gastric bypass surgery, which most of the time we'll just refer as gastric bypass surgery. We can move on to the next slide. Um, so we also should mention that some patients have already had surgery and they're looking for revision. So we do a fair number, a large number of revisions in our program, revisions of previous gastric bypasses, revisions of sleeve gastrectomies. There's still a few patients out there who have the laparoscopic adjustable gastric band, so we'll revise those surgeries if needed and convert them to other surgeries. And of note, we do more robotic assisted surgeries at Mount Carmel than any other programs in Central Ohio. I started being involved with robotic surgeries 9 years ago, and that's when I started uh, doing robotic bariatric surgeries 9 years ago. So we've been performing those procedures at Mount Carmel for a long time. So we can move on to what are the benefits of bariatric surgery. So we'll talk a little bit about medical weight loss, but really the only option that's been around for many years and has proven over and over again to be safe and sustainable is weight loss surgery. So weight loss surgery has been around for over 30 years, and the data is clear that patients are very successful with it, and that the majority of patients maintain most of their weight loss. The metabolic effects of the surgery and the weight loss will also help with other medical conditions, not just suffering from obesity, but it will also help with type 2 diabetes. It will help with high blood pressure, high cholesterol, joint pain, obstructive sleep apnea. And if you're making an impact on all these different conditions, you can only imagine that there's a lot of other conditions such as heart disease, liver disease, and so forth that are caused by those medical conditions that we help with. Um, on this slide, we talk about what other benefits are there. So, increased life expectancy, mental health, overall better quality of life. So, metabolic surgery has been shown over and over again to help with this, help with mental health, better quality of life, and increased life expectancy. Um, a lot of cancers, the incidence of certain cancers are greatly reduced with metabolic surgery as well. And then as far as success, we talked about the majority of our patients, 70% of our patients maintain at least 50% of their excess weight loss after 5 years. So that's by far the best results that we have of any options that we have for our patients, surgical or medical weight loss options. Who's a good candidate for surgery? So in our program, it's an adult program, so you have to be over 18. You have to have tried previous diets or other attempts at losing weight. It's a little bit silly. I think I've only met one person in 17 years that asked the question, "Have you ever tried other means to lose weight?" And they said no. And but that was only one person. Um, you have to have a body mass index over 40, uh, and that's if you have no medical conditions related to the obesity. But if you have medical conditions and your body mass index is between 35 and 40, you may be a good candidate if you suffer from diabetes, sleep apnea, heart disease, or high blood pressure. And some insurance plans are now starting to cover the surgeries if the body mass index is over 30. So for diabetes, especially, a lot of plans see the value in metabolic surgery to help. Body mass index. So the body mass index, it's not a perfect tool to determine who's a good candidate, but it's the tool that we use for our office, the tool that insurance companies use to determine if someone's a good candidate for surgery. The main reason is it's very accurate, but it's also very easy. All you need is your height and your weight to determine your body mass index. In certain extremes, such as people who have a lot of muscle mass, it's not always the most precise tool, but overall, it's a pretty good tool to know if you're a good candidate for surgery. And this is our BMI chart. So again, we talked about patients are candidates if their body mass index is over 40, and if their body mass index is between 35 to 40 with medical conditions, they may be a good candidate. And I might also add that with medical weight loss, and we can talk about this further, but for medical weight loss, really, medical weight loss should be reserved for patients who have a body mass index less than 50. If the body mass index is over 50, that's someone that should consider metabolic surgery. The steps for surgery, how do we get our patients ready? So we have to have you fill out an application, a pre-screening application. In our program, all the patients that are good candidates for surgery meet with the surgeons first. So I have two other surgical partners that are also here. So you meet with us first compared to other programs where patients meet with nurse practitioners and then meet with surgeons at the end. Um, there are monthly meetings that are required. It's not just our requirement, but it's the insurance requirements that require that patients meet with a dietitian or a nurse practitioner monthly before surgery. And depending on the plan, some plans are 3, 6 months, some plans are 12 visits, 12 months that patients have to do before surgery. And then we also require that you do a basic nutrition class with our dietitian at the hospital, our bariatric dietitian. And there's going to be other classes after the surgery and pre-op to go over the surgical or the nutritional requirements for surgery prior and after surgery. Some patients will require clearances. If you're completely healthy, there's not going to be many clearances except for a psychiatric evaluation and pre-op admission testing, which is standard. And that's to make sure that we are safe to put you to sleep for surgery. And if there's other medical conditions that require a clearance, such as strong family history of heart disease or personal history of heart disease, we'll refer those patients to the appropriate providers to provide the clearance. And roughly the average is that it takes 6 to 9 months from the initial visit to the time of surgery to be able to perform the surgery. The hospital stay. So when I started 17 years ago, patients were in the hospital a couple of nights, sometimes 3 nights. Now we do the surgeries either outpatient or the patients go home the next day, most of them. As far as return to work, we recommend that patients are off for 6 weeks after work. Sometimes that's not always doable for patients, so we will work with patients and try to determine when it's safe for those patients to go back to work earlier. It is possible, but generally we recommend 6 weeks off. You cannot do any heavy lifting because of the risk of hernias after surgery if you do a lot of heavy lifting. So 20 pounds is going to be the weight restriction. And we'll talk to you, since it's a long period before surgery, we'll talk about building a strong support system, having support people that are ready for you, because this is a major life change. And the only way that you can be successful and maintain good results is to change what you're doing currently and have that support system in place, which helps greatly. So long-term consideration. So for the surgery to be effective, you have to make a commitment. This is not an easy change in your life. It's a very powerful change, but to make it as powerful as possible, you have to be ready to make dietary modifications. You have to be ready to make lifestyle changes. You have to commit to being an active person. So activity, despite what most people think, does not necessarily help you to lose weight. What activity is mainly good for is to maintain weight loss. So we really have to have a plan to make sure that you can remain an active person after surgery, because without activity, it's very difficult to maintain the success. And then frequent follow up is important. So after surgery, we see our patients frequently. And then once we get to the maintenance phase after 2 years, we recommend that you see us once a year and see your primary care provider once a year as well. Um, After surgery, since we modify the anatomy of the gastrointestinal system, there are some issues with malabsorption. The issues are not as much as people most of the time believe. Now we have very good supplements that patients can take to replace their vitamins and their micronutrients. And generally, a lot of it can be combined in one pill that patients take once a day. And patients have different taste and uh, vitamins or supplements that they prefer, and there's a multitude of them that are high quality that we can guide you through to be successful and make sure that you do not become malnourished. But basically, in 2025, there's no reason that someone should be malnourished after surgery as long as they follow up frequently and they take the appropriate supplements. One of the exciting part of my jobs is we do work with a lot of patients that want to build families, and because of their obesity, that they cannot. So they have associated medical conditions or a medical condition that contributes to their obesity that prevents them from being able to become pregnant. So a lot of times we can achieve that, but we do recommend that patients are not pregnant for 2 years after surgery. The life change after surgery, hopefully as we discuss things such as reading food labels and what to eat, discover that healthy eating can be very satisfying, creating healthy lifestyle habits that we'll talk about. The goal, like I said, is to become more active, to be successful. Our program does provide lifelong support. So we have support groups, we have events that we want to see our patients to discuss that and make sure we support them along their journey. So, and we should mention briefly that a lot of people have questions about the excess skin and those things. So we partner with plastic surgery practices around the city to help patients who will need skin removal surgery. But I would say that the majority of the patients don't pursue skin removal surgery. So we'll move on to non-surgical medical management. So on the introductory slide, um, we have a line that talks about that I'm a diplomate of the American Board of Obesity Medicine. So most of my practice obviously is surgery, but I'm also certified now by the American Board of Obesity Medicine for medical weight loss, and that has been very popular lately. What is non-surgical medical weight loss? So we do have a program at Mount Carmel for medical weight loss, not just surgical weight loss. And what we're trying to do at first is to meet with each patient and try to identify barriers for them to lose weight, try to identify why they haven't been as successful as they want to be, and try to identify medical conditions or medications that are contributing to the weight gain or contributing to the fact that they cannot lose weight. So we look at your entire metabolic health, is what we call it, just to make sure that first we go with the basics and make sure that we have a strong foundation to build from, and then we'll incorporate, what can we do lifestyle wise, activity wise, and some dietary modifications. It's a program that we require that you're consistent, that you follow up. If you're not committed to follow up and doing what you need to do, you probably won't be successful. So this has to be structured. Most insurance plans are requiring now that with medications, if they're added, that patients are in a structured medical weight loss program. We are currently working on our certification of being an accredited medical weight loss program, and we would be the first in Central Ohio. So this should happen very shortly. And then we'll talk about if patients are not successful using the medical arm of the program, then we can usually, and the goal is that if they are a surgical patient that could benefit from surgery, that we could make an easy transition from the medical weight loss side to the surgical weight loss side if we need to. So, weight loss, it's everywhere. It's a big business in our country. Just yesterday, driving, uh, when I got on the interstate, the first two commercials I heard on the radio, WCOL, was about how you could get an online consultation and get prescribed a compounded medication and start your weight loss journey. But the issue with that is there's a lot of issues with that. First of all, there's no support, there's no dietary education. They don't talk about how you have to remain active to keep your muscle mass and so forth. So there's many different reasons why this is not a good option, and you may not even be receiving the medication you think you're receiving. That's a separate problem. And then, as we go through this, the medical option may be a good option for certain patients. But as I said before, the medical arm of the program is not always the best option. And this at least needs to be discussed, where we talk about the average results with the medical weight loss program versus the surgical weight loss program, and answer questions that people have about surgery, because surgery has changed a lot in the past 17 years, like I talked about earlier. And if we talk about a sleeve gastrectomy surgery now, it's actually a safer surgery than a gallbladder surgery. And for a gastric bypass, we're talking about the same risk profile than a gallbladder surgery anymore, since we are so specialized in these surgeries and have all the support and the supplements and so forth to guide our patients through that journey. So if you'd like to learn more about our medical weight loss program as well as our bariatric surgery program, the QR code on the screen, if you scan that with your phone, it'll guide you through our to our website so that you can obtain more information. You can also, through the website, submit an application to start the process, start your journey in surgery or medical weight loss. And the other option would be to call into the practice. Our practice is a private practice, Central Ohio Surgical Associates, and you can go through the website or call our main number, which is 614-228-0768, and we can guide you through either the medical portion or the bariatric surgery portion. So we are affiliated with Mount Carmel and work in partnership with Mount Carmel. So we do have plenty of time for questions. It's only 12:20, so we have at least a good 25 minutes that we can answer questions. So please enter your questions, and I think we already have some questions that people submitted ahead of time that we'll go through. Thank you.
Thanks, Dr. Pagé. I will read the questions that we're getting and just make sure you put those in the Q&A. The chat won't work, but the Q&A is where you should put those questions. We have a question that says, I frequently take NSAIDs for arthritis. I'm told I would not be able to take NSAIDs after bariatric surgery. Is this true?
So NSAIDs are it's a long answer. So the short answer is yes, you may be able to take NSAIDs after surgery. The more complex answer is that after gastric bypass, specifically gastric bypass, it's not recommended to take ibuprofen or naproxen. There's a medication out there. The brand name is called Celebrex that can be safe for patients to take after surgery, and that is an NSAID. But like I said, we also have other partners that we can consider, such as joint injections, things like that. The other thing to remember is when patients lose a significant amount of weight, the inflammation in their body goes down significantly, and the arthritis pain is not nearly as much. So, a lot of times, even if you're not taking your NSAIDs, the inflammation is so much less from the surgery that it's not as much of a problem.
Okay. This question says, where are these classes held? Only at Mount Carmel Grove City.
So I know that as far as support group, we have different options. So there's some online support options. As far as the pre-op classes, both the pre-op class, what we call the one-on-one visit with the dietitian, um, that has to be done at the hospital. So the first one-on-one visit is done at the hospital, but a lot of the subsequent visits can be done online. And I apologize, my throat's very dry. I'm gonna uh, use a cough drop here to see if I can keep my voice.
Okay. This is kind of a related question. It says, can the medical management program be done remotely or slash telemed?
It depends on the insurance. So some insurance have a requirement that it's in person. Otherwise, it's something that, yeah, we can discuss. We will require that every once in a while you come to the office in person. Um, but a lot of it can be done over telehealth. Now, telehealth cannot be performed outside of the state. So that's actually a requirement that you're in state. So you couldn't be, for example, traveling to Florida and calling in for your monthly appointment.
We have, let's see, there was a follow-up about which hospital.
So we have different office locations. We have office locations on the east side and at the Grove City location. For surgery, because we are part of a bariatric center of excellence, surgeries are only done at Mount Carmel Grove City. The American College of Surgeons only gives that distinction to certain bariatric centers. And in order to maintain that certification, we have to perform it at the one location in Grove City for the surgery, but the follow-ups can be arranged in different locations.
Okay. And we have a couple of questions related to Medicaid and Medicare. One asks, accept Medicaid, and the other says, do you know if Medicare Advantage plans offer non-surgical and surgical options?
The Medicaid question is easy to answer. So Medicaid surgery is usually a covered benefit, but most Medicaid plans require 6 months of supervised diet for patients before they're approved for surgery. They also have other clearances that Medicaid plans usually require, such as cardiac and pulmonary clearances. But usually, besides the 6 month requirement, it's not usually very difficult to get patients approved. For the Medicare plans, it's the same. it's fairly easy, and the requirement for Medicare is 3 months and not 6 months. Surgery is usually a covered benefit. Medicare and Medicaid do not have a lot of options as far as medical weight loss. They will cover counseling in the office with nurse practitioners and dietitians. But as far as adding medication to what you're doing with your weight loss, they are pretty stingy about what they will cover. They will not cover any injectable drugs for weight loss, Medicare or Medicaid. But there's other options that we can discuss for medical weight loss.
Okay. This question says, I'm a Mount Carmel colleague. Are there weight loss programs specifically for colleagues?
No, it's not just for colleagues. Although a big percentage of our patients are colleagues, Mount Carmel colleagues, and but no, it's not specific for Mount Carmel colleagues.
Okay. When it comes to non-surgical weight loss, are there any medicines you recommend? Thoughts on popular weight loss pills?
Weight loss pills, you said, Lori?
Pills. Mm-hmm.
Um, so if someone has not tried Adipex or Phentermine, that's usually where they should start. If they've never tried it, they don't have medical conditions that would prevent us from using that medication. Phentermine or Adipex as a step off point, if you've never taken it, the first couple of times it can be very effective. After you've taken it a couple of times, it's really a waste of time because your body is used to it and you won't respond to it. There's other medications on the market that we can explore. One is called Contrave, which can be very effective, especially with patients who are smoking. And there's another medication on the market that's very effective. It's called Qsymia, which is a combination of phentermine and topiramate. So that can be a good option.
Okay. Do patients typically start with medical weight loss and then move to the surgical option, or do most people start with surgical weight loss?
It's a mix. As I talked about, that if you have diabetes or other conditions related to your weight and your body mass index is 50, my advice would be to start with surgery. If you're afraid of surgery or you don't want to consider surgery right away, I would start with medical weight loss. But I would say it's a good mix of patients as far as where to start.
This question says, I have type 2 diabetes and take 1,000 milligrams metformin. Do I still take metformin if I do the medical weight loss drug?
It depends on which drug you're on. Depends on what your blood sugars are. So that would have to be adjusted individually as we check the blood sugars. But some of the medical weight loss drugs, as I think the question is hinting to, a lot of those medications have powerful effects on diabetes management. So it could be or could not be something that you would continue.
How soon after pregnancy can you be a candidate for surgery?
So we recommend 2 years. 18 months would be the earliest that I would recommend. And the reason for that is after surgery. Well, the question was
After pregnancy.
after pregnancy. Yeah. So that's after surgery. Before, there's not really a set requirement, except that you have to consider that you have a weight restriction after surgery. So you wouldn't be able to pick up a baby or a toddler that's over 15 to 20 pounds after surgery. But otherwise, I would say that after a year and a half after pregnancy, as long as you had all the right pieces to be successful in your life, that you had help with your kids and you were in a good place in your life, from that standpoint and mentally, I think a year and a half after pregnancy, you could have surgery.
If an individual has an eating disorder, would this be a suitable option for them, or should we prioritize addressing the disorder before considering any of these options?
Yeah, that's a good question. So obviously, eating disorders are very common. and it has to be addressed before we perform a surgery. That doesn't mean that it has to be addressed before we start medical weight loss. So that can be done in conjunction with medical weight loss. And once that patient is better as far as their eating disorder, we can hopefully seamlessly transition the surgery if it's necessary.
What are the side effects of surgery that we should be aware of?
So it depends on the surgery. If we talk about the sleeve gastrectomy, the main side effect that can happen after sleeve is that patients can develop acid reflux. 5% of patients will develop acid reflux. And some of those patients will do okay on medication to reduce acid in their stomach, but some patients may have pretty severe acid reflux where they either need another surgery or a conversion to a gastric bypass. As far as the gastric bypass, if you are a smoker after gastric bypass, you probably will develop ulcers in the small intestine, and that sometimes requires a revision surgery. The other long term side effect of gastric bypass that could happen would be vitamin deficiencies. If patients don't have their labs checked once or twice a year, they don't take their supplements. There's a risk of a bowel obstruction after a gastric bypass because we reroute the bowels, which is about 5 to 10% long term. The risk from a common operation, such as a hysterectomy, is about 5 to 10%, just to compare it. So, but that's really the main side effects or risks of the surgeries.
Do we need a referral from our PCP to start the program?
Depending on the program and your insurance, I would say that most private insurances will require a referral, but not necessarily. That's something that we can look into when you call the office or fill out the application.
Okay. Okay. And someone asked if you could repeat the phone number for the office.
Yeah, the phone number for the office, and there's also going to be, I believe, a transcript with slides that we'll send you. But the number for the office, it's Central Ohio Surgical Associates, the practice, and the number is 614-228-0768. So I'll say it one more time, 614-228-0768.
Thank you. And then we got a question that says, so non-surgical has less side effects, it seems.
Not necessarily. So you have to keep in mind that a lot of medications that we try, they've not been studied for a very long period of time. So we don't know what the long-term side effects are. Phentermine we know is a safe medication to use, but again, we're not talking about the same weight loss, same metabolic effects of phentermine. The same thing for Qsymia. Qsymia is those medications have been studied a little bit longer, but it's not the same weight loss. I would say those are fairly safe, and we have good safety profiles long term. If you're looking at injectable medications such as semaglutide and tirzepatide, which are the two biggest players as far as injectables, those medications have not been studied long term. They do cause some GI side effects, so they they impair the way that the body processes food and impairs the motility of the stomach. So it's really debatable which one has more side effects or not. None of them are side effect free, unfortunately.
Okay. And we're getting close to our time, but if there are any more questions, put those in the Q&A section before we wrap up here. And just to reiterate, you will get a link emailed to you with a recording of this webinar. And then also, if you're interested in pursuing one of these options or just having a consultation, you can go to our mountcarmelhealth.com, website, and fill out the pre-screening application as a way to get started. And it'll have a place on there where you can mark which type you're interested in, either surgical, medical weight management, or if you're not sure yet, there's a place to mark that too.
Yeah, I would
We
say
got
the website is probably the best place to start instead of calling in. I think the website, that way we can call you and reach out to you.
Yeah, great. Thank you. Let's see. Are the Obla Oblamon capsule saline / nitrogen gas still an option? How do they work? Do they need removed? How long?
So they will need to be removed after 6 months. It's not an option that we provide because the weight loss is limited. Most patients lose about 10% of their excess weight, and there are some side effects to it, severe nausea, risk of bleeding, and so forth. It's pretty expensive, so it's not an option that we've um, decided to provide in our program. It is available. It's something that can be tried, but it's just in our program we don't feel that for the investment that the patients make that it's worth it when we have other options.
Okay, great. Well, I think that's the end of our questions. Thank you so much, Dr. Pagé. We appreciate it.
Yeah, thanks everybody for being here.
Okay, great. Have a great afternoon. Thanks a
All right.
lot. Okay.